Hello, I am speaking on behalf of the Academic Consortium for Complementary and Alternative Healthcare. Um, I am the executive director of what we call the Centers of Excellence at Southern California University of Health Sciences, which was founded in 1911 and has degree programs in chiropractic care, acupuncture and oriental medicine, and also certification programs in Ayurvedic medicine and massage therapy. This was done in conjunction with the consortium of which SCU, our Southern California University, is a institutional member, along with two other groups, the Canadian College of Naturopathic Medicine and also another organization, the Venice Family Clinic. One of the things is that why we wanted to do this is that we realized that the training of integrative and alternative medicine practitioners is really different and often separate from conventional medicine. They're often done in outpatient clinics that are typically run by the institutions themselves. And again, so they're just separate and not put together from the mainstream medical care. A 2005 study that was done by the consortium, which for short is ACAC, indicated that approximately 34% of chiropractic and acupuncture and oriental medicine programs in the United States and Canada already had some interaction with medical physicians in terms of classroom training. About 39% had interaction with medical care in a clinical setting. And then about 30% also had some internship training programs that were involved with things such as city and county clinics. So there already was and has been some effort to try to integrate these alternative approaches with conventional healthcare. We don't have current data, but anecdotally we gather that these programs have increased considerably over the last 9 years. What I'd like to do is focus for the next few minutes on two of the programs that are in existence here. If I can get my slide up. First one is the Integrative Chronic Pain Program that is in the Los Angeles area. The program at the Sims Mann Health and Wellness Center is part of the Venice Family Clinic. Venice Family Clinic has 9 clinics in West Los Angeles that serve tens of thousands of patients. Mostly these are patients who are ethnic minorities, predominantly Spanish-speaking, uninsured or underinsured. And the chronic pain program is taking in patients who have, on an average, they're coming in with 5 years or more of persistent pain. And as you can see by the list of services there, there are a considerable number of approaches that are available to them. In addition to 2 acupuncture schools and a chiropractic program from my institution, SCU, there are several other services that are offered. Plus, there is conventional medical care. We have residents from UCLA who can rotate through there. We have physical therapy students and also mental health practitioners and students as well. So it's an extremely successful program. It's very desirable for interns to try to get into the program. It also has very good clinical outcomes with patient response to treatment. The thing that I found the most exciting, though, is that they have grand rounds every week, and you get all these different practitioners and interns together learning how to speak a common language, learning how to properly chart, doing case studies, sharing relevant medical literature, defending what they do, and listening to other practitioners explain how they might have addressed the exact same problem. It's a very good interdisciplinary learning experience. A very different approach is done at the in the Greater Toronto area in the suburb of Brampton. The Canadian College of Naturopathic Medicine has opened the Brampton Naturopathic Teaching Clinic. Now, on the face of it, this sounds like it would be an extremely good interactive situation because the clinic is in an ambulatory facility of the Brampton Civic Hospital. But the naturopathic program operates when the hospital's clinic is closed. So there's no natural integration there. Integration has occurred largely out of intention. The faculty who were selected to be there were faculty who were both very strong in their experience with naturopathic medicine, but also because they were people who understood and appreciated the benefits of conventional medicine and could speak both languages, so to speak. So what's happened is that they've been able to address a very diverse, or draw patients in from a diverse community that has largely as you can see the pie chart there, largely South Asian and West Caribbean immigrants. And through the building of relationships, partly through just encouraging their interns to write very good reports when there were mutual patients between both the naturopathic and the conventional medical staffs, and just to the development of relationships. Now we have a growing number of cross referrals that are going on. We have a grant that is being sought for interventional care of diabetes between the conventional and naturopathic medical schools. So we're getting a very different model than what I described with the Venice Family Clinic, but a similar outcome, and that is we're getting community-based care and we're getting education both of the integrative practitioners and their interns and trainees, as well as of the conventional medical practitioners and staff. And so this is extremely important for I think for both sides, but as I mentioned earlier, the integrative healthcare trainees and interns are often separate from the overall healthcare structure of conventional medicine. And they typically did not in the past see complex cases. And now they're really exposed to a diversity of patient populations. And so you very, very well may be familiar with the saying, if all you have is a hammer, everything looks like a nail. But students and interns and practitioners who go through these types of programs end up getting a whole toolkit to work with and come to appreciate not only what they can do, but also what others who are trained differently can do. So this shifts away from practitioner-centered care, which is based on your license and training, and I think really shifts towards patient-centered care. So, thank you.
Thank you very much. Our fourth speaker is Holly Wise of the Medical University of South Carolina. Holly.